When it comes to treating attention deficit hyperactivity disorder, ADHD, two common medications often come to mind: atomoxetine and methylphenidate. But how do these drugs differ in their mechanisms and applications? In this video, we will unravel the unique qualities of these medications and explore their common usage in ADHD care. Atomoxetine and methylphenidate are both stimulant medications commonly prescribed to manage the symptoms of ADHD. While methylphenidate works by increasing the levels of certain neurotransmitters in the brain, specifically dopamine and norepinephrine, atomoxetine takes a different approach. Atomoxetine is a selective norepinephrine reuptake inhibitor, SNRI, which means it increases the availability of norepinephrine in the brain. Despite their mechanistic differences, both atomoxetine and methylphenidate have been proven to be effective in reducing hyperactivity, impulsivity, and improving attention span in individuals with ADHD. However, the choice between these two medications often comes down to factors such as age, comorbidities, and individual response. Atomoxetine, mechanism of action and how it works in ADHD treatment. Atomoxetine is a medication approved for the treatment of ADHD in children, adolescents, and adults. It functions as a selective norepinephrine reuptake inhibitor, SNRI, meaning it increases the levels of norepinephrine in the brain by blocking its reuptake into neurons. This mechanism of action helps improve attention and reduce impulsivity and hyperactivity in individuals with ADHD. Unlike stimulant medications like methylphenidate, atomoxetine does not directly affect dopamine levels. Instead, it mainly targets norepinephrine, a neurotransmitter involved in regulating attention and impulse control. By increasing the availability of norepinephrine in the brain, atomoxetine helps normalize the activity of certain brain regions implicated in ADHD. Atomoxetine is typically administered orally and is slowly absorbed by the body. It takes several weeks of consistent use to reach its full therapeutic effect. This delayed onset of action is an important consideration when prescribing atomoxetine, as it may require additional support during the initial treatment period. Methylphenidate, mechanism of action and how it works in ADHD treatment. Methylphenidate is another commonly prescribed medication for ADHD management. It belongs to a class of drugs called central nervous system stimulants. Methylphenidate works by increasing the levels of dopamine and norepinephrine in the brain. These neurotransmitters play a crucial role in regulating attention, impulse control, and hyperactivity. The primary mechanism of action of methylphenidate involves blocking the reuptake of dopamine and norepinephrine, allowing these neurotransmitters to remain in the synapse for a longer duration. This leads to increased activation of the brain regions responsible for attention and impulse control, resulting in improved ADHD symptoms. Methylphenidate is available in various formulations, including immediate release and extended release formulations. Immediate release formulations provide a quick onset of action, while extended release formulations provide a more sustained effect throughout the day. The choice of formulation depends on the individual's needs and preferences. Similarities and differences between atomoxetine and methylphenidate. While atomoxetine and methylphenidate are both effective in managing ADHD symptoms, they differ in their mechanisms of action and pharmacological profiles. Atomoxetine primarily targets norepinephrine, while methylphenidate acts on both dopamine and norepinephrine. Another notable difference between the two medications is their potential for abuse and addiction. Methylphenidate, being a stimulant, has a higher potential for abuse and dependence compared to atomoxetine. This is an essential consideration, particularly in individuals with a history of substance abuse or those at a higher risk for developing addiction. On the other hand, atomoxetine may be a suitable alternative for individuals who do not respond well to or cannot tolerate stimulant medications. It is also a preferred choice for individuals with comorbid conditions such as anxiety disorders, as it does not exacerbate anxiety symptoms like some stimulant medications can. Effectiveness of atomoxetine and methylphenidate in managing ADHD symptoms. Both atomoxetine and methylphenidate have been extensively studied and proven to be effective in managing ADHD symptoms. Numerous clinical trials have demonstrated their ability to reduce hyperactivity, impulsivity, and improve attention span in individuals with ADHD. In a randomized controlled trial comparing atomoxetine and methylphenidate, both medications were found to be equally effective in reducing ADHD symptoms. However, individual response to medication can vary, and it may take some trial and error to find the right medication and dosage for optimal symptom management. It is important to note that medication alone may not be sufficient for comprehensive ADHD care. Behavioral interventions, therapy, and educational support should also be incorporated to address the multifaceted nature of ADHD and promote better overall functioning. Common side effects and safety considerations of atomoxetine and methylphenidate. Like any medication, atomoxetine and methylphenidate can have side effects. Common side effects of atomoxetine include nausea, stomach upset, decreased appetite, and fatigue. Methylphenidate, on the other hand, may cause appetite suppression, insomnia, and increased heart rate. Both medications may also have more serious side effects, although they are relatively rare. These include liver problems with atomoxetine and cardiovascular events with methylphenidate. It is crucial to closely monitor individuals on these medications and report any concerning symptoms to a healthcare professional promptly. Safety considerations should also be taken into account when prescribing atomoxetine and methylphenidate. Individuals with certain medical conditions, such as glaucoma, heart problems, or a history of substance abuse, may require careful evaluation and monitoring before starting these medications. It is essential to discuss any pre-existing conditions or medications with the prescribing healthcare professional. Choosing between atomoxetine and methylphenidate, factors to consider. When deciding between atomoxetine and methylphenidate, several factors should be considered. Age is an important consideration, as certain formulations and dosages may be more suitable for specific age groups. Atomoxetine, for example, is approved for use in children, adolescents, and adults, while methylphenidate has different formulations tailored to different age ranges. Individual response and tolerance to medication should also be taken into account. Some individuals may respond better to one medication over the other, or they may experience intolerable side effects with one medication but not the other. The presence of comorbidities, such as anxiety or substance use disorders, may also influence the choice of medication. It is crucial to involve the individual and their caregivers in the decision-making process. Understanding their preferences, concerns, and goals can help guide the selection of the most appropriate medication for their specific needs. Combination therapy. Using atomoxetine and methylphenidate together. In some cases, a combination of atomoxetine and methylphenidate may be prescribed. This approach is typically reserved for individuals who have not responded adequately to monotherapy or who require additional symptom control. The combination of these medications aims to target multiple neurotransmitter systems to optimize symptom management. Combination therapy should only be initiated and monitored by a healthcare professional experienced in ADHD management. It is essential to closely monitor for any potential interactions or increased side effects when using multiple medications concurrently. Case studies and patient experiences with atomoxetine and methylphenidate. Real-life case studies and patient experiences can provide valuable insights into the effectiveness and tolerability of atomoxetine and methylphenidate. Stories of individuals who have successfully managed their ADHD symptoms with these medications can be encouraging and offer hope to others facing similar challenges. One case study reported the story of a teenage boy who experienced significant improvements in attention and focus with atomoxetine. The medication helped him succeed academically and regain confidence in his abilities. Another case study highlighted a young adult who found methylphenidate to be life-changing, leading to improved productivity and better interpersonal relationships. While these case studies provide anecdotal evidence, it is important to remember that individual experiences can vary. What works well for one person may not necessarily work for another. It is crucial to consult with a healthcare professional to determine the most suitable treatment approach for each individual. Conclusion. Finding the right treatment for ADHD: atomoxetine versus methylphenidate. Atomoxetine and methylphenidate are two commonly prescribed medications for the management of ADHD. While they differ in their mechanisms of action and pharmacological profiles, both medications have been proven effective in reducing ADHD symptoms. The choice between atomoxetine and methylphenidate depends on various factors, including age, individual response, comorbidities, and safety considerations. It is important to involve the individual and their caregivers in the decision-making process to ensure their needs and preferences are taken into account. In some cases, a combination of atomoxetine and methylphenidate may be prescribed to optimize symptom management. However, this approach should only be implemented and monitored by a knowledgeable healthcare professional. Ultimately, finding the right treatment for ADHD requires a comprehensive approach that includes medication, behavioral interventions, therapy, and educational support. By tailoring treatment to each individual's unique needs, it is possible to improve ADHD symptoms and enhance overall functioning and quality of life.